Okay, we'll just move ahead with the panel then. No, not at all. Our new normal is technical difficulties. Um, Thank you, everybody. My name's Winston Wong. I'm part of the Roundtable on Health Equity, as sponsored by the National Academy of Sciences, Engineering, and Medicine. Also, in my day job, I'm the medical director for community health at Kaiser Permanente. For those of us who are so inclined, we do have a Twitter account. So if you want to tweet and be a participant in more ways than one, we do have a hashtag CA Wildfires. That's again, hashtag CA Wildfires. And if you are a Twitter devotee, I would encourage you to participate because it does increase the buzz about our workshop and the importance of this subject. We also have hashtag wildfire and health as a tagline. So if you want to go under that title as well on your Twitter account, please feel free to do so. Again, CA Wildfires or Wildfires and Health with the hashtag in front of it. As was mentioned, this particular workshop is actually sponsored by a number of roundtables that exist within the National Academy of Medicine. The Roundtable on Environmental Health Services, Research in Medicine is a sponsor. The Roundtable on Population Health Improvement is a sponsor at the National Academy. The Forum on Medical and Public Health Preparedness for Disasters and Emergencies, and my roundtable, the Roundtable on the Promotion of Health Equity. And to that extent, I did want to extend my appreciation to Karen Anderson, who is our program manager for the Roundtable on Health Equity, and my honor to also introduce to all of you Dr. Tony Villarreal, who is at the Dean at the School of Nursing at Penn, who is the chairperson of our roundtable. So we've been very much excited about collaborating across the roundtables in terms of putting this particular workshop together. As Ken did, and I have to mention, thank you, Ken, for, he mentioned he used to be the head of California's health department. Probably the bigger task was to really cheer our work group here because it was a lot of different voices to be heard and a lot of organizing to do. Thank you, Ken, for your leadership, and thank you for your support. We do have our next workshop now on populations impacted by wildfires. I think our first workshop really provided a very good overview. Now we want to really look at some of the special populations that really rarely get the headlines that wildfires tend to cover in terms of the populations that we don't think about. A homeless population, as mentioned in Colorado, populations that don't necessarily have houses but are actually renters, or migrant populations and indigenous populations. So our next workshop will deal with that. Kathleen? Okay, so we're going to actually try to do the video right now before I introduce our workshop panelists.
Buscar una estabilidad para vivir por las altas costos en la renta. En 2 horas nos cambió completamente la vida, a mí y a casi 10,000 personas en esta ciudad. Después de los incendios, lo más difícil ha sido buscar una estabilidad para vivir por las altas costos en la renta. Y también pienso que lo emocional ha sido uno de los retos más grandes que tenemos que enfrentar ahorita. No supimos cómo regresar a la casa, porque no había letreros. Todas las casas aventaban lumbre, todas tenían humo. Se miraba gris, completamente gris. Cuando llegué a ver ahí la casa, fue muy triste para nosotros llegar a ver todo eso. Ver nuestras ilusiones quemadas, nuestros sueños, una vida de sacrificios, completamente hecha cenizas. Mi esposo me abrazó y me dijo, ¿cómo le vamos a decir a las niñas? Y yo le dije que no sabía.
In the 2017 fires, the Spanish-speaking population in Sonoma County was disproportionately harmed by not only the fire, but by the response to the fire. We like to say the fire was an equal opportunity harm, but the recuperation, the recovery, and the support was much worse for the Spanish-speaking residents of this county. Before the fires, there was a 1% vacancy rate. We lost 5% of our housing stock in Santa Rosa. So if you do the math, it's really clear that renters are out. And it also affected Daisy and Carlos in a really big way. They lost a lot. They were renters, so they didn't have renter's insurance. They had started saving money to buy equipment so that Carlos could eventually have his own business. All that was lost.
Yo fui a aplicar algunos apartamentos de bajos ingresos, pero las listas de los bajos ingresos son muy largas. He buscado un apartamento también, pero el más barato que encontré fue de $2,300. En Coffee Park pagaba $1,700 y apenas me alcanzaba el dinero. Pagar $2,300 ahorita es como que no podemos hacerlo. Entonces decidimos quedarnos aquí y esperando que la señora de la dueña de la casa nos dijo que ella va a reconstruir y que nos tenía considerados para volvernos a rentar, o lo mismo que era que si ella un día planeaba vender la casa, los primeros a los que les iba a ofrecer la casa eran nosotros, porque ella dice que ella cree que es un derecho que tenemos de que nos dé la oportunidad de regresar. Yo he preguntado a mis hijas qué quieren hacer, a dónde quieren regresar después de donde estamos. Y la única respuesta que me dan ellas es a Coffee Park. Entonces es uno de los retos que creo como familia vamos a enfrentar. Y que esperamos y que se puedan lograr. No sé cómo, pero tenemos que lograrlo.
Well, thank you for sharing with us as an audience that very powerful video. To amplify on these aspects, we have this distinguished panel. You can read their biographies in your pamphlet, but we'll be starting with Oscar Chavez, the Assistant Director of Human Services at the County of Sonoma that was featured here in the snippet. Don Hatkins, Professor of Geography and Planning at California State University in Chico. Genevieve Flores Haro, Associate Director of the Mexico Indígena Community Organizing Project in Oxnard, California. And finally, Andy Miller, Dr. Andy Miller, the health officer for Butte County in California. So thank you.